Hi, my name is Sarah Long. I'm a nursing student at Middle Georgia State College, and I'm doing a case study on Jared Smith for chronic pancreatitis. And my partners are Jasmine Smith and Paula Black, and they were unable to attend the creation of the video, but we all did the group work together, so that's what counts, and I volunteered to do the video. So this is for all of us. That being said, we're going to get started on Jared. He's 47 years old. He was admitted to the ER with severe abdominal and back pain. He was diagnosed with chronic pancreatitis 2 years ago. And let's see, he's the owner of a construction company, highly stressful job. He's been married for 25 years and has 2 grown children. That's a little bit background. When he came into the ER, he told me, the nurse, that he's been drinking alcohol for every day for the last few years. And he's been smoking 2 packs of cigarettes a day for the past 20 years. And as we know, for chronic pancreatitis, long-term use of alcohol exacerbates the occurrence of acute pancreatitis onsets. Okay, anyways, moving on. So he's admitted to the ER, and I, the nurse, start an IV of normal saline at 125 milliliters per hour. He complains of severe abdominal pain, and he rates that a 9 out of a 0 to 10 scale. And his abdomen is soft and non-tender, and there are bowel sounds in all 4 quads. So, what medication should I, the nurse, expect to administer to relieve Jared's pain? The answer to that would be morphine, 5 milligrams IV, and I need to dilute that over a 5-minute period. This is because morphine is commonly used for pain relief for moderate to severe. Alright, the healthcare provider writes a prescription for Jared of a new diet, which is nothing by mouth, because oral intake is withheld during this time to inhibit pancreatic stimulation, so that the pancreas doesn't secrete pancreatic enzymes. Okay, the ER nurse, that's myself, I prepare to transfer Jared to the medical floor. So what intervention should I, the nurse, implement before I transfer him? The answer to that would be to insert a nasogastric tube and connect to low intermittent suction. This is to relieve his nausea and vomiting. Alright. 3 hours after being admitted to the ER, Jared is transferred to the medical unit and he's stable, and Paula takes over the case. So, the nasogastric tube is draining green bile, and Jared reports his pain a 4 on the 0 to 10 scale. So, let's see. Paula is now able to develop a plan of care for Jared. So Paula includes in the plan of care, she administers oxygen through nasal cannula. This is to decrease the workload of the respiratory system because it is overworked right now. So, good job, Paula. Alright. Paula, with assistance of an unlicensed assistive personnel, is assigned to care for 5 clients, including Jared. So what task can Paula delegate to the unlicensed assistive personnel? The answer is she is able to delegate obtaining a blood glucose reading of the patient, of Jared, and it needs to be checked every 4 to 6 hours, and she needs to report to Paula after she gets the results so that Paula can make sure that everything's in order. So, after receiving, Paula's interventions, Jasmine steps in and she takes over the case. She removes his nasogastric tube 3 days later. He started on a clear liquid diet now, and he can tolerate eating without pain, or a clear liquid diet without pain. The healthcare provider plans to remove his diet restrictions gradually and discharge Jared completely within the next 2 days. So, what nursing intervention has the highest priority when Jasmine is preparing Jared for the discharge? The answer is to explain the importance of alcohol abstinence to Jared because he is a chronic drinker or an alcoholic, and that's going to make it almost impossible for him to get better if he continues to drink. So, alright, so Jared goes home and he has a follow-up appointment with me, the nurse. Let's see. I asked Jared if he's complying with all the discharge teaching that Paula, Jasmine, taught him. And he tells me that he doesn't drink much alcohol, and he's trying to cut down on his smoking. He adds that he has quit drinking tea and cola, but he has to have his morning coffee. He tells the nurse his stomach hasn't been hurting as much, and he reports stools of a fatty, bubbly, frothy consistency. They float on the water and they have a foul odor. So, how do I need to respond to this? I need to tell him that it is okay. This is common in patients with chronic pancreatitis. So, just tell him it's okay. But we will give him medication to help him have normal stools, because nobody likes having extremely smelling stools, Jared's healthcare provider explains that his pancreatitis is getting worse and he needs to comply with all the teaching that Jasmine gave him. And he's prescribing him more medications to help with the bowel movements. And he's also providing some pancreatic enzymes. So, he's prescribing Prilosec. What statement accurately explains the scientific rationale for the use of Prilosec? The answer is that Prilosec decreases gastric secretions. Next. So I need to teach Jared a few things about the medication that he's going to be on, because he's now on Codazem for the... Codazem is to help reduce the fatty acid stools, and the Prilosec was for the gastric secretions. And all I need to do is make sure that he's not allergic to pork. And because it's made out of a hog, the Codazem is made from the pancreas gland of a hog. And he needs to take his medicine with meals or snacks. So Jared and his wife did not actually realize how serious chronic pancreatitis can be, even though they've been diagnosed with it for 2 years. They just didn't think it was a big deal. So next, now he's asking more questions, and he looks interested for once, and he's concerned of the pancreatitis. So I talked to him about some interventions that he can implement while he's at home, away from us, and help him out. So the nurse, me, I'm concerned that Jared continues to smoke cigarettes, but my highest priority is that the chronic alcoholism. I need him to quit drinking. So I refer him to an AA, or I encourage him to attend an AA meeting, and he wants to know why it'll help him quit. And I explained to him that it's a 12-step recovery program, and through this through the meetings, a sobriety is maintained through a sharing experience. Everybody shares what happened to them, and they say their strengths and their weaknesses. And it's very encouraging and uplifting. So the meetings help. The nurse, myself, I conclude the teaching session when Jared asked, "Am I going to die if I keep drinking?" So, how am I supposed to respond to this? And the answer, surprisingly, is that I need to be very blunt with him. I don't need to sugarcoat it or nothing. So I tell him, "Jared, if you don't stop drinking, the disease is going to kill you." So, he needs to know the truth. So tell him the truth. And he states, "I just don't know if I'll be able to stop drinking. I've been drinking every day for the last 20 years of my life." So apparently he's been drinking for 20 years. I thought he was smoking for 20 years. He's probably been doing both for 20 years. So, what nursing intervention will be most beneficial in helping Jared and his wife plan for the future if he is unable to modify his lifestyle? I wouldn't say scare him, but make him realize, or make him recognize the reality of the situation. I'm going to discuss the need to complete an advance directive or a will for when he dies. That'll get him. So my outcome of the case, or our outcome, Jasmine, Paula, and me, Jared and his wife leave the clinic with written information about chronic pancreatitis and the numbers to the Alcohol Anonymous organization locally. And they have my number and Paula's and Jasmine's if they have any questions. And he has a follow-up appointment in 2 weeks, but it's truly unable to determine what's going to happen to him because it's up to him what's going to happen. We're hoping with the love and support of his wife and his family, he will be able to get sober and manage his pancreatitis, but it's up to him. So I hope this helps you understand what chronic pancreatitis is. They drink a lot of alcohol. Not all the time, but a lot of the time. So, thank you. Bye.